So, hello everybody. We are glad to have you here with us. Today we are talking about homeopathic treatment of kidney disease and kidney disorders. And I'm very glad to have Dr. Rajeshwari Rapata here. We are still waiting for two other colleagues. So in the meantime, dear Rajeshwari, I would ask you to introduce yourself, and I try to connect to the others in the meantime.
Hello everyone, good afternoon, good morning, good evening, wherever you are. I'm Dr. Rajeshwari Rapata and I'm the former Dean and ex-professor of at MUHS, and I've been teaching anatomy, and I'm a homeopathic consultant since last 23 years. This is for my introduction, and let's start with the conversation.
So I'm just posting to Priya that I did send her the link on email again. So hopefully she will be here soon.
Yeah.
So the kidneys. Kidneys are vital organs. So the treatment is very valuable, and it's very valuable that they can be treated with homeopathy, that we don't have only allopathy or naturopathy to deal with them. I myself had a few times inflammation of the pelvis of the kidney, which was very, very painful as I can remember. My granny had glomerulonephritis and suffered a lot from that. What is your experience with clients and infections, inflammations in the urinary organs?
Now, I remember a very peculiar case some years back I had. And this patient was a person who had donated his one kidney to one of his relatives. And now he had only one kidney. Yeah. And after around 2 to 3 years after, he started having fluctuations in the uric acid levels. They were increased, and he started having the arthritis, the gouty complaints. There were the nodosity started developing in his joints, small joints and all, and the pains, acute pains and all started getting. And as soon as he noticed that his uric acid levels are increasing, he was concerned, because he didn't want to take any other medicines, allopathic medicines as such. And then he consulted me. And according to his personality and all, first I started with staphysagria. Because I could guess that after the operation which happened, he should have been given the staphysagria. And I gave him staphysagria. And slowly, after taking his case, I came upon the remedy of Formica rufa. Formica rufa, I gave the fire ant, the medicine which is made of from the red fire ant. So I gave Formica rufa, and there was the decrease in the symptoms, and he was very happy. But the same symptoms started occurring again. Through there was a temporary relief of the complaints. Again, the complaints started coming. And when I went through the boric, the footnotes of boric, there are surprisingly I saw there's the formic acid. And I gave him formic acid as a follow-up. And at this time, there was a drastic a decrease in the uric acid levels, and he almost felt so better that he was very happy and said that I'm feeling so better that absolutely there are no pains now. Because early morning, whenever he used to get up, start walking, his soles were painful, his small joints were painful, he was limping and all. And drastically the pains reduced, and till 1 year there was no complaint at all. After that, he went to, I think, foreign country, he went to the Middle East, and then there was no follow-up after that. But Till 1 year, he got absolute relief and was not at all feeling. After 5 years, again, I got email from him, and he said that he started getting those pains again, and he insisted in giving that medicine only. Ma'am, give me that medicine which you had given last time. So I said, let's see, let's have a consultation. And after having the consultation, I thought the same remedy should be given to him. And again, I followed up with the formic acid. And again, now there's no reply, nothing, like is absolutely fine. So that's one experience I had with the person who had donated his kidney. Now, there were some colleagues whose experience I will tell, where they have also given medicines to the people who had got their kidneys transplanted. Now, it's very difficult to take such case, but they have got amazing results on those patients also. Now, coming to my own experience, when I was working at a remote place, absolutely, I was so much engrossed in the work that I forgot to drink water. And one fine day, I saw that I started getting a severe backache, and I went and got my X-ray done, KUB and all, and I saw that there were 2 big stones in the pelvis region, both the kidneys. And the thing was, that region where I was working, they had a hard water. And the doctor also said maybe it's because of the hard water and you got a sudden change of place, maybe because of that. And then finally, this was all the things followed up by a allopathic doctor at a reputed hospital. But he also suggested that you get your lithotripsy done, or you need to get your open abdominal surgery for that removal of the stone. I said, no, that won't be possible. I was not agreeing for that. And then finally, I consulted my own colleague, and he gave me one amazing remedy, that is Triticum vulgaris.
Wow.
Now, I couldn't even imagine that I will need that remedy. So these 3 remedies, the grass remedies, 3 grass remedies, the wheat, the sugar cane, saccharum, Triticum vulgaris is one, okay, and bambusa. 3 grass remedies, which are frequently we get these remedies for the modern day complaints. So I was one of that modern day lady who needed this Triticum vulgaris for my complaints. And after taking that medicine, the 2 stones disappeared. I don't know how they disappeared, but they disappeared. And on follow-up X-ray, I found that there was no stone. That's my own experience. In the similar way, there were so many patients, with minor kidney complaints, urinary tract infections, honeymoon cystitis. Frequently, these minor complaints of kidneys were there, and they were cured by homeopathic medicines.
That's great.
That's my experience.
So the story with the stones is really great, and that with the kidney donation, rising uric acid, and then cured by formica acidum, that is great. That is great. How much would a patient suffered if it not met in homeopath? Priya, thank you for coming online. I heard you had Zoom issues. That always can happen.
Yes, I'm very sorry for my tardiness, but I had some issues. I couldn't log in and finally sorted it out. Thank you so much for having me.
Hi, Priya.
Hi, Rajeshwari. How are you?
Yeah, I'm fine.
How is the weather? The rains?
I'm at Mumbai, so no rains.
Okay.
It's warm and hot here.
Yes.
We have the rains, Priya. We have the rains and the storm now.
All right.
And in Australia, they have 44. I just realized.
Yes.
It's very hot there. We are still missing Pallavi, but maybe she has issues too. So would you like to introduce yourself and then we go into the discussion and have a look on kidney diseases and homeopathy?
Yes. Thank you so much for having me, Marianne. Hello, Rajeshwari. And my name is Dr. Priya Subramanian. And I am the founder of an online mental wellness platform called as Vitalia, which we began last year. We are mainly dealing with psychiatric issues for using homeopathy successfully for treating, helping people with psychiatric issues. And we also do a lot of continuous medical education programs along with and under the guidance of Dr. Mahesh Gandhi. He is a very well-known psychiatrist and homeopath who for the last 30 years has been using homeopathy successfully as a primary mode of treatment for his patients who come to him with psychiatric issues. So it's very challenging and very interesting arena that we are working in.
Yes, so you can tell us about emotional and psychological disorders that go together or easily go together with kidney complaints.
Yes.
What did you see?
I would not say that. Well, I think pathologically speaking, Rajeshwari has many more years of experience in dealing with kidney issues than I do. But what we are noticing is where there is, an energy blockage. You can say that it can be the second chakra, where there is an energy blockage there, and where the water element is mainly involved. So, from the aspect of Chinese medicine. And this is where mainly issues arising from that, where you feel that, love and care is not being done, or you didn't receive the nourishment, love, care, affection that you needed in your infancy or in your growing years, is where normally going forward, if that energy block continues and if this, the soil is right, you might see kidney issues. As Dr. Rajeshwari pointed out very well, the three main remedies that she talked about, which is the triticum, the saccharum, and what was the other one, Rajeshwari?
Bambusa.
Bambusa, excellent. Yeah, they're all monocot remedies that lie in the nourishment line, and they lie in the sort of natrum line actually. And their correspondence is with the subclass 4 remedies, where you have all your, in the dicots, you have all the remedies which are to do with love, care, and nourishment, right from your Malvaceae, which has your chocolate and the other allied remedies. And going forward, you have the Thialis before the Malvalis. In Thea, you have the, remedies like Hypericum and Thea itself. And then you have remedies like Garcinia gambogia. You have these remedies going forward in the subclass 4, which is the Yakir Gandhi plant chart, if you will see. And in the monocot side on the fourth column, you have all these remedies. The triticums, the Poales family and this Arundinacea family have the bambusa, and then the triticum is the wheat, isn't it? So it directly indicates that your nutrition line is affected, that at a time when you should have received this love and care unconditionally, there was some block, you didn't receive it, or you received it and you experienced it as a sort of lack in your body. And this corresponds with the natrum line or the sodium line in the periodic table. And this is where you see all these remedies. So interesting that the three remedies that Rajeshwari mentioned are all in that monocot subclass 4 line. So I was amazed to hear that. And if you look at formic acid, again, it is a carbon compound which acid and carbon compound. So it has a direct correlation to your nourishment somewhere. And if you speak about Formica rufa, then it in the invertebrates, it belongs to the insecta, where, with the fire element and with these kind of pains, you would expect with the uric acid diathesis being there, so it's the elimination, again, water element that comes up, water and earth. And in case of, yeah, it's mainly water and earth that you would see. So again, we're talking about receiving unconditionally, the bonds with the mother, bonds, the multi-generational bonds which are there, and the matrilineal line of remedies. These are all, so because it is about giving and receiving and the balance between giving and receiving. So you could say broadly, it is the balance between perhaps imbibing food and completely, eliminating it successfully. So receiving and removing, perhaps you could say, in this, when it pertains to the kidney. So it's
we have
very interesting.
Oh, I can add in one thing. The remedy I got when I had this inflammation, this pyelonephritis, was Natmu. Well, it was the same line again. It was very, very successful. And we have a question incoming that says, good morning, does Lycopodium belong to this subclass?
No, Lycopodium belongs to the ancient family subclass, which is much before all the division between the into the dicots and monocots. We're talking about the ancient plants, a completely different group of remedies which have your mosses, ferns, conifers, and all those other group of remedies. And these are the the ones which preceded the division into the monocots and the dicots, which are the angiosperms. These are the completely gymnosperm remedies. Lycopodium is there. The Lycopodium is for the uric acid diathesis, along with your Tuja, which, and your entire Pineaceae family, which is in the ancient plants. Again, you have the pineoles, which, are kidney injuring compounds, and the terpenes which are there in the pines. And again, those remedies you'll see are very, very well indicated in kidney urinary bladder symptoms. So that's a completely different class of remedies. They belong to the ancient plants.
Yeah. So if there's another question, please post it in the chat. Priya, what was your most interesting case concerning kidneys?
Well, I only remember with the one where, in a woman who was middle-aged, and she had these kidney issues where the pains were, radiating across. So from the left-hand side, they were going all the way up to almost the splenic area and to the left shoulder, and then they were going across to the other side of the pelvis. So, and there was a constant changeability along with this uric acid high and kind of red sediment in the urine. So, when you see these changing pains and different radiating pains, then you think of the Berberidaceae family of remedies. And there is a very nice remedy called as Berberis vulgaris, which fits in with these symptoms where you have the changeability. So it belongs to the first subclass and very closely related to the Ranunculaceae family, again, which has Staphylococcus aureus, which has Pulsatilla, which are very well known. But the Berberis family is also the barberry family, is a very well indicated group or family of remedies in the urinary complaints. So it worked very well.
Yeah, especially in stones.
Yes.
Yeah. Even in
generally animals. A lower potency, a 6C, can be given, twice or thrice a day. It can be repeated for 5 days till the elimination of the stone happens. And then you can continue with constitutional treatments to make sure that, that the scarring is taken care of and the general excretion capacity is improved. And then you deal with the main underlying reason which caused, the stone to form in the first place.
Yeah. Yeah. So we have stones many times now. For an allopath, it's nearly unimaginable that stones just dissolve. Now, Rajeshwari had the experience herself. I had the experience myself. You did see it in clients. How can this happen? What do you think? How does the body do it? Only by being given information from the homeopathic medicine. How does it do it? Oh, I think Priya is frozen. So the answer is yours.
Yeah. So body has its own healing mechanism. Like Priya said, that the second chakra is involved, where the emotions, your feelings, your flexibility, whatever, when you get stuck up in that stage, that's your emotional stage. And that reflects on your body. And when it reflects on your body, then you see that you get that constipation, you get that urinary retention, you get that urinary complaints, you get the stones forming in your kidneys. All these things happen. And when you see that, slowly when your emotional stage is relieved, okay, it is released, and slowly you see the complaints also decrease. You know? So how does homeopathy help here? How does homeopathy help here in relieving your emotional symptoms, getting out of that stuck stage, and then finally your physical symptoms also dissolve, like the kidney stone starts dissolving, your constipations release, the continuous urging to stools, all that happens. So that also releases. So all these things happen, the homeopathic medicines, when they are given on the basis of your individual symptoms, then it works in releasing those emotional feelings. So it boosts up your emotions, your body, to find yourself released from that prison of your emotions, feelings, and your environmental stage, which may be because of some external influences as well. So it helps in boosting your own body's mechanism to help yourself, and thus the symptoms reduce.
So it's mainly deblocking and
Yes.
releasing energy flow, and the self-healing mechanisms of the body are fit enough to dissolve whatever is to be dissolved. I actually saw a tumor disappearing within 2 minutes, just when the energy flow came back. Absolutely impossible if you only think of allopathic medicine, but it's immense what coming back of an energy flow can do. We have another question here. My financial condition is not good. How can I practice homeopathy? Because of financial problems, should I do allopathic practice? Please understand and give me guidance. So is it that in India homeopathy is more expensive than allopathy? No.
Which country is she from? He or she?
Sounds Indian, the name to me. Nikhil?
It's not so expensive as such as compared to the other systems of medicines. She can easily get admission into any homeopathic medical college if she clears off the NEET exam.
No, from what I can understand, this is somebody who's asking whether she should practice allopathy or homeopathy, isn't it, Marianne?
It's not so clear from the sentence. Now comes explanation, because earning is late in homeopathy. No, we can't.
I don't think earning is late in homeopathy. No. Once you start, because right from your student life, you need to understand the cases. You need to take up cases, right from your internship stage. If you keep on waiting, as compared to the allopathic system, I would rather say that homeopathy is the best. Earning is earliest if you practice it sincerely and honestly.
Yes, and this is if you practice it sincerely and honestly.
Yeah,
and
so I was reading
if you learn.
I was reading a quote that said that don't just about any art form also, don't just, practice it superficially. You have to force your way into the secrets. You have to familiarize yourself with the concepts. And as Margaret Tyler says, you have to read that remedy so many times that you can identify that, as you would identify the steps of your friend walking up, up the stairs, and that that's Marianne and that's Rajeshwari coming up the steps.
Exactly.
And this is someone else. So it's a question of familiarity. The minute you familiarize yourself and make it your own, and you force your way into the secrets, this is not,
I
we
I
we
remember
all
when,
studied in normal colleges. I
yeah,
don't think that we went to any hi-fi, and we were surrounded by professors and teachers who sincerely continued to teach and learn and self-study. And I meet my professor even now. He reads every day. My colleagues read every day. I don't have an everyday reading habit yet. I read alternate days. So that's something that I'm going to change from. I intend to make that change from December. So it's just that. And I think if you look at it from, without sounding like that I'm giving a lot of advice or gyan, it's, if you look at it from the viewpoint of earning money, then you'll pursue the wrong thing actually. You should look at it from the viewpoint of learning, then money comes on its own.
exactly,
Definitely.
exactly.
Money is
I
going to come on its own. Where is money going to go?
I remember, Priya, as you said, same thing. One of the spiritual gurus says, "Stay confused. That will help you."
Mm,
And that is what happened to us when we were students. We were always confused, and that is what made us explore more and more. And another thing is we had to do lots of charity. We
mm,
had peripheral OPDs, and then hundreds of cases we have to see, and without any expectation of money and all. And that is what helped us. When we saw so many cases that there was no intention of money there, but we were looking at the patients as the remedies, homeopathic remedies.
mm,
When a
mm.
patient came, that remedy, we had that remedy in the mind. So this remedy or that remedy, because hundreds of remedies are there in homeopathy. So confusion, one thing. Second thing is exploration, explorative nature because of that
Yes,
confusion.
yes.
Both of them helped us. So whenever, whether they are the relatives, whether our friends, whether our teachers or anybody, even when we go to movies, every character was a homeopathic remedy for us. So that added to our experience.
Absolutely. If you wake up someone and they're still groggy eyed in the morning, they can tell you what phosphorus can do, what is the sphere of action, what is the first three lines in Boga Synoptic before the, in bold, where is the main sphere of action. That's the way that, that's the passion that you have for something. And it's a lifelong purpose. It's not something that's for a few years you make your money and you move out. It's not that kind of career.
No,
No, it's not. This
it's
is for
something
life. This
you
is
do
it
from
for
the heart.
life.
You do it from the heart. You do it for
Yes.
your spiritual life, and as you said, if you're good in it, money comes with itself. You don't have to worry about that.
And one of the tip I would like to give is that your honesty, your interest in the human being who
Hmm.
comes to you for treatment, your genuine interest in his suffering is that which draws the patients to you.
Hmm.
But if you have money in your back of mind, that vibe go to the patient. It goes to the patient. He understands. And that's how you lose patients also.
Definitely, definitely. Being a
So
homeopath or an allopath or a naturopath, if the client gets that you're only interested in his money, he will go. And why not? Why should the client stay?
hmm.
A doctor should be interested in the health and should care. This is what we are about and
Yeah.
what our life is about. Rajeshwari, you said you had some interesting cases and wanted to talk about something? I remember in the beginning you said.
Yeah, that interesting case I already explained. But another one I would like to say was a small girl. In fact, one of my relative itself. But this girl, she was continuously getting cystitis, urinary tract infections, always, almost every other month. She used to suffer with burning pains, stingy pains, and difficulty in urination. So many investigations were done. Almost every time the investigation was normal. Maybe once or twice she may have got the infection results as positive, but homeopathy helped her. How? I would say she was so much greedy for candies. She had lots of sweets and she has a tendency to eat always chocolates, Cadbury's. Always she had a stock of all those different kinds of chocolates at her home. So based on this, I gave her saccharum. And after that, she got relief. Every time I used to give saccharum, she used to get relief. But this happened recurrent, so she should get a permanent cure. So when I inquired more with the parents and all, I saw that these parents, both the husband and wife, they were having frequent conflicts at home. And the small girl, she was not able to understand anything. She was not able to weep. And when I secretly asked her, she said that I feel like weeping, but I can't weep. That was a stage. And finally, I gave her Staphylococcus aureus. And with Staphylococcus aureus, she got relief from that. But then again, after 5-6 months, she got the same complaint. This time I increased the dose, the potency I increased. And then finally, she got relief of all the complaints. And now it's all around 2-3 years, she's not getting any complaints. So in this way, we need to find the root cause, what's happening with the child's life or the patient's life. Some things patients won't really reveal to you easily unless we probe into their life and understand what's the situation. So that was the situation where she was feeling stuck in that, and she was not able to express. She was not able to. This small child with so much of emotional internal conflict, she was not able to tell anybody, neither father. She couldn't ask her father to stop quarreling with her mother, or her mother to stop quarreling with her father. So that was the stage where she was stuck in the family. And finally, Staphylococcus aureus helped her.
Isn't that interesting? The case again started with the sugar remedy, and then in the same class of remedies, Staphylococcus aureus comes up again. So there's a lot of emotional conflict and being stuck in emotions which cannot be handled. If I think of myself, the time I needed that Natmur was absolutely the same thing. We never knew whether our parents were about to split up or not. We children were discussing what we will do in case they would split up.
Yeah.
So goes the same line again. Did you see more difficulties in being nourished from the mother than being nourished from the father?
No, it's not a question of nourish either from mother or father. You can have a very strict mother who's very masculine, or you can have a very giving and nourishing father who's very feminine. So it doesn't really matter. I apologize for the background noise if you're picking anything up, but it's not about this natrum line is about receiving unconditional love and care and nourishment from either parent in a very feminine way, in a very nourishing, caring, unconditional way.
So it's again about the energy. It's about the feminine energy, not mattering from which body it comes. That kind of energy. So in this line of remedies and in this line of cases, we see a lot of talking about energy and chakra and stuck energy.
So there is a balance between giving and receiving in the subclass 4, and and issues that come in the matrilineal line or in the mother line, multi-generation across. So and by the end of the fourth subclass 4, that column, there is tired of giving and receiving, and right there at the end you have the caparalis, you have the cucurbitalis first, and then the caparalis. You have this group of remedies who are now tired, who are they're bitter because they're giving so much and they're not receiving. So that group of remedies also, even briny is a very good remedy for your kidney complaints, and there you will see that the energy is of an adult who's saying that my life amounted to anything. I've been giving and giving and giving from a very young age, and now I find that my life perhaps has not amounted to anything. There is nothing left for me, and for the time when I grow old and I will need it, there is nothing left for me, and that is where the bitterness comes from in the cucurbitalis. And that is where the fears come from, the anxiety for the future comes from, and the talks of the business comes from. And briny is also a very good remedy for your renal colic and your issues where you don't want to be disturbed, or you just want to be left alone, and any kind of movement or jar affect, and as a physical general, because now you're in your place of comfort, and physically and mentally you don't want any kind of movement or change in position,
because you think it will only be for the worse,
and that you will come to want.
I understand that. So the only way out for clients who suffer from kidney disease and diseases in the urinary tract is that they head for their own spirituality, and that they find the love they didn't find with the parents, that they find it from the divine and develop it in themselves.
Yes, if that is where they are stuck, or that is where their energy is stuck at that infancy line, where however old they are, they still feel that they are stuck at a point in their life when they should have received unconditional love, care, and affection from either the mother or the father, and they haven't received it. And they can be however old, but they're still stuck in that infancy. So if that is the running theme throughout their entire life, then yes, they would need remedies from the column 4 or subclass 4 of the plant chart, which is the delinealis, and you have all these group of remedies, right from the thialis to the caparalis.
I'm just thinking of animals that have been thrown away by their mother. They tend to the same thing.
Like the magnesium, again, the natrum and magnesium, the two, either the natrum mu, the mag carb, mag mure, mag phos. You have the laccan in the animal remedies, and you have the lac defloratum. They're all in that energetically, or in the understanding wise, they are all in the natrum line.
Yeah. It's very interesting to me. Just thinking of a horse who got moon blindness. It's an infection of the eye. Still in natrum state, and that horse was very miserable. Needed a lot of attention, needed a lot of care. Probably the same thing.
Could be even chocolate was very clingy and needs a lot of love and care and hugs and kisses, and gets completely hysteric and panic when it's separated from the primary carrier. Can be Malvaceae family, which is the anal, where so hence the tantrums. And this is in subclass 4 again, Malvaceae chocolate. As a remedy, it's very important for people who feel abandoned and forsaken and didn't receive the love, care, and attention, and will resort to hysteric tantrums and to get that attention. And saccharum is the monocot counterpart, which is very, very violent and is kind of intensified because it's on the monocot side and much more destructive, and with the sweaty scalp and all the other accompanying symptoms that you see.
Very, very interesting to me. So do we have any questions in the chat? At the moment, not, I think. So we tend to another case, maybe? Anybody wants to tell anything? Rajeshwari, do you have some again? Because Priya obviously has a problem.
Discuss upon the stages of the chronic kidney disease, where the 5 stages, most of the times we find that to the homeopaths, people usually come at the last stages. That's very difficult to treat. In the first stage, there's a very little damage, at second stage or third stage, maybe it's easier to treat the patient. But when the patient comes with the 4th or 5th stage, then it becomes very difficult. That's what I experienced. Otherwise, right from the minor cystitis or normal infections or stones, the cases are easier to treat. But when you find that in the final stage, it becomes a little bit difficult. I don't know what's your experience, Priya.
So when the dilatation has happened, in the pelvic, so then it, you have to continue monitoring and continue taking care, and you have to monitor over many, many years. You cannot at any point of time claim that, you've completely cured it, because it's such a critical area where if dilatation happens, then, you have to monitor. And, the BUN levels have to be checked. The creatinine level has to be monitored. We're looking at, at that point of time, anything below 2, we say that is okay, is moving on the path. And even if that remains as such, without losing sacrificing any further function of the kidney, and you would still call it in maintaining phase. You would not label it as cured.
Yeah.
So it's critical.
But that's where it is a challenge for the homeopaths. When there is a continuous need of the continuous monitoring. When the patient is hospitalized, or when he is on dialysis, or when he is in the hospital care, that's where the homeopaths are needed to be present in the hospital premises, or as a consultant in the hospital, where they can help the patients there. So how many hospitals have this kind of facility is a question mark.
Yes,
so
and how many allow?
How many allow is a question mark. And this is what the Ayush Ministry or the government officials, they should notice that homeopaths play a vital role in restoring the patient's health in such kind of diseases also. So in every government hospital where such kind of facilities are available, dialysis facility or for patients' care for kidney diseases, that's where the homeopaths are needed, where they can help the patients along with the interventional care.
Yes.
Definitely, because it's about of energy and rising energy levels and freeing the chi again, it will help the client. I remember a lot of cats that had rising creatinine because of glomerulonephritis, which is quite common in them. And we usually did pick Q potencies for treatment. How do you do this in India?
So the indicated remedy in 6th potency or 30, you need to keep giving it along with any kidney support remedy in Q potency. In water, you have to give. So, maybe sometimes 2 remedies are needed if it's a diabetic patient or an elderly patient. And sometimes you even, if the family calls and if the hospital allows in the ICU, Even a remedy like arnica can help improve the urine output if it is after, an injury, if it is after a cardiac intervention or something like that. And if, dialysis can be avoided by just improving the urinary output with arnica 30, 200 maybe hourly, one pill just in the lower lip, if it can be avoided with, then that is still, I would say, still any success that we can take. If you can manage to avoid that circle of dialysis in an elderly enfeebled patient, that's still, something.
Definitely. So we have another question. This is about the system of Dr. Gandhi, the system of Rajan Shankaran, and the question how the best to study it.
So the basis is all in the classification. If you see in Clark's Dictionary of Materia Medica in volume 3, he has begun to actually classify plants as per the natural order into the group of, if you see also compare with, you have a comparison that is happening with the members of the same family. So Dr. Rajan Shankaran has taken this a step forward and put them into families and is now working on it further. Dr. Yakir, approaches it from the APEG system. You have the gymnosperms, the angiosperms, the dicots, the monocots, and also keeping in line the lineage. So you can see that sometimes the rosalis, or you can see maybe peonia as a remedy is actually in subclass 4, but is related to, the ranunculalis in the lineage. So with the DNA analysis. So this Yakir system is much, much more, I would say, in depth and much more keeping in mind the various lineages where, they have separated and where one has gone ahead to form the D. linealis, for instance, or the Peonia family. And Dr. Yakir has, Mikhail Yakir and has written the book. Dr. Gandhi has worked on the inner ages where all these remedies are put in the chart made by Dr. Gandhi as per the inner age of the patient, which is the Erik Erikson's inner ages. So it's all following on the same path that, Clark began. But as time goes ahead, as you get the input of genetics, as you get the input of further understanding of the plant families, there is more and more and more clarity. So I would suggest that you begin with the Yakir's book, understand the Gandhi Yakir plant chart, read the book, and understand it from Clark's Materia Medica point of view. You'll see that it's going very in the same track. And correlate it with your cases. Understand the inner age of the patient. For this, you would need to understand the basic psychiatry, and then you go forward and you do that.
I think this was an European colleague asking, and some of them did not understand that yet, that it is necessary to study, in some way, study botany to really understand homeopathy.
It is. As I was saying, it's something that Clark began. And so maybe you want to mute yourself briefly. Yeah. So the dogs got excited with our discussion. So yes, so I'll, Dr. Marianne can pass on my email ID and I can help you in any way that you'd like. But yes, this is the path that you will take to, Marianne, you have my email ID, right?
I have your website.
You can write it off.
I'm just posting it.
You can just write my email ID. They can write to me, and then I can.
Yes, I can.
We are doing a couple of programs with Dr. Gandhi where we are following this. We're also doing a program called as Vital with Vitalia, which is a monthly understanding of the Yakis chart that we're doing. Currently, we have finished exploring subclass 1, 2, 3, and 4. And just this month, I've introduced subclass 5. So we're going ahead and doing that. So it's an ongoing it's an ongoing understanding, it's ongoing study.
Is it a private discussion or like a paid one, or is
this
it
is a paid
free?
one? This is a group who've been meeting for the last year. And last year we completely explored subclass 1 from August with cases and step by step. And this year we began with the Hamomalidae family. We finished that. We finished the Caryophyllalis, which is subclass 3, which is a cactaceae. We finished subclass 4, which is your Dillenialis. And just this month, I've introduced them to subclass 5, which is your family beginning with the rosids and continuing onwards to the Apialis.
What is your view about some materia medicas which are based on organs, like William Bird's physiological materia medica?
In fact, I was just going to mention that while one does this, one has to also understand, for instance, if you look at cyanothus as a remedy, and if you can understand it from the botanic point of view, which natural order and which family it comes from, if you can understand berberis from that point of view, then it adds that added layer to your understanding, to your nuance. Then, along with your podophile, maybe berberis doesn't help, but podophyllum, which is in that same family, which is just, Berberidaceae, and it's in that same family, maybe that would be a better fit. So looking at it from this botanic point of view gives you alternatives wherein, if one member of that family has helped up to a particular point, you ask the brother or sister, that other member of that family, to complete the cure. So you're keeping everything in-house and within the family, as it were. So it's brilliant. It makes so much sense to have it all organized. And then it's also organized in your head. So you don't miss out on a remedy, like, you're thinking of China self, then you don't, Burnett has put China self, cyanothus, your lycopodium, your berberis, all of them also in for your splenic remedies. So you can understand, if you look at the plant chart, that China self comes in the rubialis. So, which is why cyanothus also is going to help. I think the organopathy, or what was it called? Physiological organ remedies.
Physiological medica. By
So
William
somewhere
you find there each medicine, each homeopathic medicine, and its effects on the organs and physiological effects. Yeah,
absolutely. There's a very interesting footnote in Cyanothus where they're saying that all those who followed this and they were led astray found in the outer fringes homeopaths who were doing this similar work. So, those who followed the organ remedies and who were perhaps, if I'm not misquoting, who were perhaps disgruntled or felt that, it wasn't progressing forward, and they went out of that group, they found, sure enough, the homeopaths were working towards this from the other direction, but with that homeopathic understanding. So it's all very syncretic. It goes together. It's you're understanding the same thing from this side or from this side, but keeping the patient in the center.
Yeah.
We have another question for Priya. This is, did you see bird remedies being related to kidney and bladder diseases?
No, much more eye complaints and rheumatic complaints.
So it goes in another direction, definitely.
Yes.
I remember a client where the prominent sentence was, "If my mother would have only loved me." She always has had kidney problems.
You were directly talking about the natrum line.
Very directly, yes.
Yes.
It's very interesting to look at it from that point of view. Any other case you want to present? Something that comes in your mind? Does anybody have kidney cancer, client?
Dr. Balwinder has, and he has more bladder cancer cases, and we were supposed to, in fact, sit before this and talk to him and get a few cases, but he's incredibly busy. So I did speak to him, and he was the one who suggested that, we talk about it as much more of a uh, conservative management of kidney than what we were initially thinking of. So he has a lot of he has patients in with a lot of pathology who come to him, and that is where these organ remedies and uh, in-depth understanding with the various ways that we're working in health. Equisitum is a very nice remedy also. Lycopodium and Equisitum hyemale.
Yes.
It also belongs to the same family as Lycopodium, where it's a horsetail fern. So again, with the bladder symptoms, not just the bedwetting, but also, bladder cancer, maybe you can think of.
Equisetum hyemale, I remember using in my veterinary office as a plant remedy for dogs that had involuntary loss of urine after castration. And it worked always very well. That is actually where we was using it.
And in the monocots, there's another remedy called Sabal cerulata, which is also very, very important remedy, which you will think of in this kind of, in older people.
Older people
again,
with bladder
and prostate, yeah.
In
the palm family.
We can't say it is whatever medicines, homeopathic medicines, not only in chronic but acute, it works wonderfully. That's one thing which I have noticed. I had many kidney cases or urinary cases for acute complaints. Acute complaints, I have wonderful experience.
Which was the remedy? I didn't quite get it.
Sabal cerulata.
Sabal cerulata. Okay.
Sarsaparilla is one. Equisetum, as she said. In children, frequently I had given for bedwetting cases many times. Equisetum, sepia, causticum. Causticum, involuntary urination, especially in after the menopausal stage, I had given for many cases. Causticum had worked very well.
It's very interesting. So, if you don't have any other case to present and we're still missing Pallavi, I'm just wondering whether we are coming to an end here, or is there any other thing that you intend to say which is important for you, because we're not getting questions at the moment? Anything else you want to say which is important to you?
I think Rajeshwari has said it all right when I joined, keeping the patient at the center and,
There's a question coming whether we saw involuntary loss of urine in constitutional belladonna clients.
No.
No, I wouldn't say no. I never saw. I couldn't even think of it as a toxic state. No.
It's an acute
retention of urine, yes, in belladonna, but involuntary loss, no, I never saw. So, to summarize for our kidney clients, think about the energy blockages, think about everything that is retained in the second chakra and is not released yet. Think about the feminine energy of your parents and grandparents and the nourishment. Don't forget about all the sugar remedies. Anything else I missed, which was very important?
think about the homeopathic medicines in interventional care in hospitals?
Yes.
Like Priya said, arnica works very well. Staphylococcus aureus works well. So 3 medicines I would suggest: arnica, Staphylococcus aureus, and yes, causticum.
And remember that even stones can be resolved without any problem. Nobody has to go to surgery. If you find the right remedy, it can be done. And don't forget about the epigenetics, because not being loved by the mother or a feminine aspect of the family is a prolonged impact on a family throughout generations. Now we have it, I think.
And also, don't despair. If you stick to it, then homeopathy is going to give you, your bread and butter. And look at remedies in the same family. If, one has worked and stopped working, maybe like berberis and podophyllum is a classic example. So,
Yeah.
look in the same family. The brother or sister might help you. The botanic brother or sister.
Yes, and study botany, because
those who are using the software, homeopathic softwares, you have the filters there. When you want to look after the medicines, all in the animal kingdom, you get it. And in the plant kingdom, you get all that. Then you can compare it. If you want to further improve your level of diagnosis of the homeopathic medicines. So you can
simple enough. It's a simple enough plant chart, actually. Yeah. It just takes a little bit of time acclimatizing yourself to it. And soon enough, you're thinking in terms of subclass 1, 2, 3, 4, 5, and 6. And you know whether it is this side or this side. And then you know that the natrum line is this. So we're talking about the subclass 1. Then it has to be, the ranunculalis where Staphylococcus aureus is there. Or pulsatilla, for instance, is there, which is also a very good remedy. So we're looking at remedies here, or in the monocots, which the one that Rajeshwari suggested. The
Yes.
3 bambusa and saccharum and triticum, they're all there.
Definitely. And for our colleague who is not sure whether to do allopathy or homeopathy, we can recommend, don't go by money, go by your vision, the vision you have in your life and the goal you see for your life. What do you want to accomplish on this planet in this life? And then do that, what suits that.
Absolutely.
Do it by heart and with all your spirit. Think of the client, not the money.
Okay. Let's not dishearten the students who feel that sometimes maybe homeopathy may not earn, but let me tell you that there are live examples of homeopaths who drive the Mercedes and the BMW.
Absolutely.
So don't get disheartened and practice it with passion, and it will get you whatever you want.
Usually being good at heart is rewarded.
Yes, exactly.
One way or the other. I can't say that I earned a lot of money with homeopathy, but I could save my father's life. And what does that mean? Can that be paid? It's not possible. So I would encourage everybody to learn homeopathy and to practice it, but you have to choose for yourself. And my dear colleagues, I thank you very much for being here on this Sunday. I hope next time Pallavi will be there, and then I hope nothing happened to her. I will inquire about that, and yes, see you probably in December somewhere. Okay, thank you very much for being here, and have a nice Sunday.
Bye, Rajeshwari.
Nice Sunday. Bye-bye.
Bye. Thank you, Marianne.